I'm Dr. Danielle Hicks, and this is the treatment group video for dissociative amnesia with dissociative fugue. Our client is Percy Black, and he is 48 years old. We have two differential diagnoses: dissociative amnesia, which we ruled out because client's symptoms are better explained by another mental disorder, and dissociative amnesia with dissociative fugue. There are two primary diagnostic features. The first one is disruption in memory of personal information, particularly one's identity. And the second one is amnesia occurs in association with one traveling away from home. So now on to Percy Black's story. He is a 48-year-old man who was brought to the emergency room by the police because he was involved in a fight at the bar where he works. When the police arrived and began to question him, he gave his name as Barry Weaver, but could not provide any identification to verify that his name was Barry Weaver. He had arrived in town several weeks earlier and began working as a bouncer at a local bar. He could not recall anything about his life prior to his arrival in that town. Although no charges were brought against him, the police insisted that Percy get a medical evaluation. Percy willingly accompanied the police to the local hospital's emergency room, and on examination, Percy was able to state the town and state he was in and correctly stated the day of the week and date. There was no evidence of drug or alcohol use, and his neurological exam was negative for head trauma, and no other medical issues were noted. It was the emergency room doctor's assessment that Percy's memory loss was probably psychological in nature. Percy is able to recognize that his memory lapse is abnormal. However, he expresses little curiosity in getting to the cause of his memory loss. It was determined that a psychological consult was in order, and Percy willingly agreed to this in spite of his lack of interest in determining the cause. A missing person check was run by the police, and a match was found for a person who was reported missing in a town 325 miles away. They contacted the person who filed the missing report, and it happened to be Percy Black's middle son, and he actually has 3 sons. The son explained to the police that his father had gone missing about 4 months ago after a series of stressful events. He explained that his father, who had worked for many years in a middle management job at a national retail chain, had been turned down for his latest request for promotion. He was also told that he was on probation and in danger of losing his job. On his arrival home after his meeting at work, he was greeted with a note from his wife stating that she was tired of their marriage, noting several of his deficiencies as a husband as the reason for her leaving him and seeking a divorce. When he sought solace from his eldest son about his work and marital issues, he was met with cold indifference. His son, who was his mother's favorite, stuck up for his mother by insisting that all of her complaints about Percy were right and that he didn't blame her for leaving him. Percy left his elder son's home despondent, and no one had heard from him since. His middle son, the one that filed the missing persons report, drove the 325 miles to identify Percy, and on his arrival, Percy swore that he had never seen his son, the man, before. And that is Percy Black's story. So now on to the multi-axial diagnosis. On axis 1, we have dissociative amnesia with dissociative fugue. On axis 2, we have none. On axis 3, we have none. On axis 4, we have work stressors, marital separation, and fight with son. And we gave him a GAF of 65. So, theoretical perspectives, we have 2. The first is psychodynamic perspective. The client's dissociative amnesia could be the use of the defense mechanism of repression. He is repressing memories of who he was in his past history in order to avoid the emotional pain associated with the memories. The second perspective is behavioral perspective. His memory loss could be seen as an avoidance behavior that is operantly conditioned. His memory loss occurs unconsciously, but the behavior is voluntary. The client has learned that his memory loss enables him to avoid dealing with the aftermath of his stress due to problems in his workplace and familial life. Therefore, his memory loss is negatively reinforced. And that's it for the treatment group video for dissociative amnesia with dissociative